The Sabah Report. The Sabah Report.
منتابع لقائنا الصباحي نحن وياكم لليوم لحتى ننتقل لموضوع جديد مع ضيف جديد. ضيفنا لليوم هو دكتور وليد أحمد, Clinical Director, Consultant Psychiatrist, Children, Adolescents and Adults at Maudsley Health. Good morning, Dr. Waleed. Happy to have you with us today.
Good morning, Rania. How are you?
I'm great. And you?
I'm all right. Great. Thank you. All good.
Thank you. So we're going to talk about mental health today. And of course, mental health conditions can often be challenging to identify and to understand. Could you please share with us some known signs and symptoms that people should be aware of, which may indicate the presence of a mental health condition? So what are the signs that we can catch early?
Excellent question, Rania. But first of all, I'd like to take a moment to congratulate you and you guys on the radio to, put a spotlight on mental health during the show. And it's fantastic to see you guys giving mental health well-being a platform because then you're true partners with us in our kind of business and in trying to help people promote mental health and break stigma. So what you're actually offering at the moment is a safe space for us to discuss this openly, but also for your listeners to think about, how they can access mental health services.
Yeah.
So your question about, mental health, as you probably know, Abu Dhabi and Department of Health, their top priority from healthcare perspective is to have a healthy population, both mentally and physically. So there are two things there, and mentally is actually mentioned first.
Yeah.
So I think, when we talk about mental health, often people will talk about anxiety, feeling low in mood. And when things become very serious, they think about, sometimes quite very painful emotions around hurting themselves or ending their lives. Now, this is very, quite common in people's understanding. But as you said, there are many subtle symptoms that we may not recognize until it's too late, that we might be experiencing that would indicate a mental health problem.
Like
For
what?
example,
Yes,
for example, yes. For example, changes in appetite and weight. Now, eating habits, suddenly gaining a lot of weight or maybe losing a lot of weight can be indicative of a mental health problem, especially in depression. People lose appetite, but sometimes in a different kind of depression, you can actually increase the amount of food that they eat because maybe people are managing their emotions emotionally in a different way by eating a lot.
Okay.
Other things like physical problems which are not explained by any tests, like unexplained headaches or pain. Sometimes people feel they lack concentration. They're not really focusing properly in their work. And a common complaint that people have is that they become unusually irritable and angry so easily. So moms and dads sometimes, they might start shouting at their children for maybe small reasons. And those kind of things can also indicate that perhaps, they're struggling with something, their mood's affected maybe, or they're stressed at work that they need some help with. So these are some of the kind of subtle signs that people might feel, and sleep is, again, Rania, sleep is so important for mental health. And if you're finding that you're sleeping less or sleeping too much, this can also indicate a mental health problem.
Beautiful. Beautiful. Yeah. Thank you, Dr. Ahmed. Okay, so Dr. Waleed Ahmed. Okay, so now if we want to talk about people and mental health, and we have to agree on this, that accessing mental health services can be sometimes scary for many individuals and daunting for many individuals. So what are some practical steps or resources that people can use to access mental health services in an effective way? And how can they navigate or through potential barriers in seeking help?
Yeah, great. So at Maudsley Health, we want to make the patient journey the most seamless as possible. So in terms of your listeners, and if they're thinking about, how can we access, the first thing would be knowledge. Knowledge is powerful. So accessing good quality, websites like our websites or known websites from the NHS or from the American websites that would provide some good information about mental health problems. If you have a concern, you're already seeing your family medicine doctor, family physician, or general practitioner. Maybe bring up with them that you're not feeling that well, and how can you access. Perhaps they know services that they can refer to. There are many, family and friends. Now, don't suffer alone. Try and talk to somebody. They might be able to, flag up maybe resources, or they might be able to help you to find out about mental health services. Google who are your nearest providers, and do some research for yourself. Look at the clinicians who are there and what their qualifications are, or maybe they deliver the kind of therapies that you're looking for. And can I just say that on a very practical basis, check out your insurance coverage.
Okay, thank you. We always cover mental health on Sabaho on Star FM. And of course, we had too many episodes about mental health and adults.
Well done.
And adults, yes.
And, well done.
Thank you. Recently, we had as well a few episodes about mental health and children. So now, if we want to hear from you about the services at Maudsley Healthcare, how do you cater to the needs of both adults and children, and what are some key approaches or treatments used to address mental health conditions in these different age groups?
Great question, and I think Maudsley Health is better known for their children's services. So we have a dedicated at Maudsley Health, we have a dedicated child service, child and adolescent mental health service. We have a dedicated child psychiatrist and child clinical psychologist. We also have educational psychologists and speech and language therapists and occupational therapists, all under one roof. So if your child or young person is having sort of any issues or is struggling, they would be, what you would expect is for them to be seen by a senior clinician. Usually we advocate they see a doctor, because a psychiatrist would be able to do a biopsychosocial assessment. So sometimes with children, there are some things that are physically that might mimic some of the symptoms of mental health. So a doctor may be able to recognize that better, and then do a formulation of their problems, discuss it with the mental health team that we have here, and then eventually the child and the young person will be able to access therapies. Now we have clinicians who are trained to deliver cognitive behavior therapy, dialectical behavior therapy, family-based treatments, because often children and young people, they obviously live in families, there are issues within the family relationships. So we help families go through that. Now, some young people and children might have particular problems around ADHD or autism spectrum disorders, and we have clinicians who are trained to do specialist assessments for these kind of problems and difficulties. And then once we have an understanding of these problems, we have particular treatments to help with kids with autism and ADHD through strategies and social skills training. And again, with the help of our other colleagues with speech and language and OT, because often these children require multiple clinicians to work with them. And so early intervention is key. So do not delay. I think all the evidence suggests that you intervene early is better. And I think we have a dedicated child services. I'm quite proud of them, and as our adult services, that we have clinicians trained to deliver the services to the children.
Okay, that's good to know. Thank you so much, Dr. Waleed Ahmed, Clinical Director, Consultant Psychiatrist, Children, Adolescents and Adults at Maudsley Health. It was great having you this morning, and Adha Mubarak. Thank you.
Pleasure's all mine. Eid Mubarak to you.
Thank you. Thank you. Bye-bye.
Thank you. Bye.
The Sabaho Report. The Sabaho Report.